Go ahead.
Greetings, DBH colleagues. I think we're in day 1 million of COVID. Maybe not. Maybe it's not quite 1 million, but it feels that way. I'm down to no nail polish. I didn't bother to curl my hair today. But I will say that it is Mental Health Month still. And so it's super important. Hopefully you got our thank you message that went out to everyone, I think, yesterday. But it's super important that all of us really focus on self-care. And so for me, that means taking care of myself and my family. I haven't been able to work out as much as usual. I had knee surgery last week since I spoke to you last. But it went well, and I'm doing really well. But it's certainly doing those things that we know, taking breaks, focusing less on some of that conflicting news we might be seeing right now. We'll talk about that in a minute. But it is Mental Health Month. Take care of yourself, wear your green, and stay healthy. All right, so COVID, world by the numbers. We're almost to 5 million cases worldwide with almost 325,000 deaths. One interesting factoid I heard this week, and this is one of those things that you really understand where the polarization and divisiveness comes from. But I didn't realize that the flu counts that we hear each year, the deaths by flu, are not actual recorded deaths, but they're actually an estimate that the CDC makes each year. And so some of those comparisons between the flu and COVID probably aren't accurate, because COVID is actually counting those COVID cases of individuals who died who had a positive COVID or presumed COVID versus the number of flu deaths each year. That's just one of those examples of things that makes it kind of confusing. I've heard a lot of people saying that, well, you know, they're just saying someone had COVID or saying they died of COVID to increase the case counts and make it where they make more money. And one of the things I would tell you there, I mean, obviously most of you know that my husband works in the hospital setting, and I've been on a lot of the phone calls, and I'm not hearing that at all, and he's not hearing that at all. That's anecdotal, but one of those things that it's really important to kind of check yourself about. The other thing is that diseases or illnesses like COVID don't actually have a mechanism where they kill the person. It's actually much like, someone gave this analogy, I thought it was a good analogy. AIDS didn't actually, or doesn't actually kill people. AIDS reduces your immune system and makes you more susceptible to getting a disease that might kill you. Flu is like that as well. I asked my husband this question as a physician in the emergency department: how many people do you remember dying of the flu? And he couldn't really recall many people across his, 3-decade career that came to the emergency department with known flu who died. But oftentimes people who do have underlying health conditions or have an immune response to things like the flu or COVID end up dying. And that's what we're seeing. So I just throw that out there as one other example of carefully looking at some of the things you see out there, and don't let them upset you, right? There's a lot we don't know. That's a lack of information, as opposed to misinformation where people in charge are actually informing you of things that they know not to be true, lies or fake news. And that's not what's happening right now. We're all doing our very best to give you the information we have and not tell you things that aren't true. Okay, so U.S. We're a little over 1.5 million cases and over 92,000 deaths. In California, we went from about 70,000 cases last week to almost 82,000 this week, and from 2,847 deaths to 3,334 deaths. And in Fresno County, we're around 1,287 cases with 17 deaths. So what are we doing? We are continuing to analyze return to work requirements, and what that means is what are we going to do when people enter and exit the building, common areas, masking, all the things we talked about last week. I will say that we're assessing telework both short-term and long-term. As I mentioned last week, we're going to continue telework through May 31st, and I plan next week to inform you on a planned schedule, which really depends on some negotiation that the county has with the state, which I'll talk about in a minute. We are continuing to daily remotely health screen all staff and visitors at all of our facilities. I imagine that will continue. We'll talk about some of that in a minute. And then acquiring personal protective equipment. We're really working hard to understand what our needs will be for the foreseeable future. There was an announcement today, a new order that Dr. Ray Zvora, our interim public health officer, signed related to masking recommendations. It's an update, and it's requiring all people in public and in offices to wear masks if they're not able to maintain the social distancing, the physical distancing of 6 feet. And so what that means is that we're being asked to wear a mask pretty much all the time when we're out in public where we can't keep distance from other people. You may have noticed that at most of the stores now are requiring masking, and this kind of codifies that. I'm sure it will be controversial, as everything else is. I wanted to share with you some information that we're tracking. This might be a little hard to read. This graph shows you the impact on our services of COVID-19. And if you look at this graph on the far left side, that very first bar is the first week of the year. And that was a week where we actually only had 2 working days. So that number is pretty low, and we can kind of throw it out. That's why it's highlighted in green. And then you go through, and each bar that's highlighted in green really corresponds to a week that we had fewer than 5 working days. So any day that we had a holiday, you should expect to see reduced services. And then the bar that has kind of a reddish-orange highlight, that's the week that we started telework. So you can see that telework has had an impact on us. If you look at the last few bars, though, my caution for you there is it typically takes us about 4 to 5 weeks to fully enter all of the charges into Avatar. So what these bars represent are the charges entered into Avatar, the services that have been entered into Avatar. And what we find is, particularly for our substance use disorder providers, it takes about 5 weeks. It doesn't seem to take quite as long for our mental health providers, but it does take a while. So for instance, the first week that we started looking at this, the numbers, even in the very first columns, were different because sometimes it might be 8 weeks later that a few charges come in. So typically what I've been doing is looking back 4 or 5 weeks and looking at what the trend is. We think we've seen a decline of about 10 to 15% in our volumes because of COVID. And so what that means is, good news is we've been able to preserve quite a bit of our volume in our shift to telework. But there is some volume that we've lost. And what that means is people who need our services might not be getting them. That's part of what we'll be looking at with telehealth and telework as we move into the future. There are some people for whom telehealth isn't going to work now or possibly in the future. They may not be comfortable, they may not have a safe place in their home, a private location where they can have telehealth or telephone services. They may not have the equipment to have those services. As we look forward, we're going to be doing a survey of our clients in terms of their satisfaction with telephone and telehealth services. We're also carefully reviewing these service impacts, really breaking them down by age. So we're looking at adults versus children, as well as services and programs. So we may find, for instance, that for the transitional age youth population, it's working really well. Might not be working so well for young kids, for instance. And so that's the kind of thing that we'll be looking at very carefully as we plan for the future in terms of telehealth and telework services. The other thing I really want to emphasize, and let me show you one more graph, and this is the people served. So the graph just prior was the actual services provided, and this one shows how many individuals received services. So a little fluctuation there as well. Again, you see those green highlights are weeks that we had a holiday. And then the reddish orange highlight is when our telehealth services started. So definitely a little bit of a downward trend, remembering that those last few data points probably aren't accurate. But as time goes on, we'll have a much better idea. But I've gotten this question over and over about how long will telework continue? Will I be allowed to continue working from home? I can't emphasize enough that it's going to depend a lot on the ability to get the work done, whether that's clinical services or administrative services that you do. If we can't establish a metric, a way of measuring how effective and efficient a particular task or position is at getting the work done, then we likely will not be able to continue teleworking. If we're able to establish a metric and we can show that we are efficiently and effectively getting the work done, whether it's in office or telework, then that's an area we might consider. If we're not able to properly equip everyone to do telework at home efficiently and effectively, then some positions will not be able to work at home in that regard. So those are the things we're looking at. We'll be carefully reviewing that along with our workplace configurations in terms of the COVID spreadability and such. All right. I do want to review with you the governor's budget that he revised. There's always, every year in January, the governor proposes a budget. Remember, our fiscal year starts July 1st, and then come May, there's what's called the May revise. So as we go through the months between January and April or May, we look at how we're doing financially, not just because of COVID, but it just happened to fall during that period this year. And then the governor does a May revise budget. Well, as you can imagine, the budget has changed substantially. So when the budget was proposed in January, it was projected that California would have a $5.6 billion surplus, and unemployment was at a historic low of 3.9%. The May revise predicts a $54.3 billion deficit, so that's about a $60 billion swing. Unemployment is expected to peak at 24.5% in the second quarter of 2020. What that means is about a six-fold increase in unemployment. And unemployment insurance benefits, which had been projected at about $5.8 billion, will now be $43.8 billion. The general fund revenues are expected to decline by $41 billion, and that's largely due to a decline in personal income tax, sales tax, and corporation taxes, which are expected to drop by more than 20%. They are expected to balance the budget for that fiscal year, but out-year deficits will continue. What this means in terms of some of the proposals in January, they were expecting to expand Medi-Cal. That is canceled. They're going to have to pull money from the rainy day fund. That's the budget surplus fund that the governor has really worked hard over the last couple of years to begin to kind of like a savings account, as well as $450 million from safety net reserves. They're also going to borrow and transfer about $4.1 billion from special funds and temporarily suspend some net operating losses and limiting the number of credits for taxpayers that they can use in any given year. And then reducing spending, and you might have seen it on the news that the state is planning to reduce state salaries by 10% and operating budgets by 5%. I'm sure I'm going to get the question, what does this mean for us? Will we be cutting salaries? Will we be cutting positions? At this point, I do not know exactly what it will mean, but in the next slides, I'm going to go over what's expected to happen with our budgets across the state for behavioral health. So this slide shows you that our estimated funding, how it will change. So in 1819, and we have three main sources of funding, and one more that I'll talk about in a minute. One is 1991 realignment. And that's largely the pot of funds we use for a lot of our mental health services. The 2011 realignment is the pot of funds that primarily, not solely, funds a lot of our children's and SUD services. And then our Mental Health Services Act is where we fund prevention, early intervention, capital, education and training, that type of thing, IT funding. So last year, that was about $4.7 million. One other source of funding for us is anything that we bill Medi-Cal for, we typically pull down some federal funds, and that's about 50% for people who qualified for Medi-Cal prior to Obamacare, we'll say. And then for the Medi-Cal expansion population, we get closer to 85 or 90%, I think we're down to now. And then with the CARES Act, and remember the CARES Act is one of the stimulus packages recently passed by the federal government to support us through the coronavirus. And with one of those stimulus packages, we were given a little bump in our federal participation monies of about 6.5%. So that will offset a little bit of this. However, remember that with a decline in services, even with that bump per service, we have fewer services, so we may not be able to make up that difference. So in 1920, this year, it was a significant decrease from last year. Part of that is due to expectations for decline in COVID, and part of it because some of our MHSA revenue was deferred from this year to 2 years from now. Next year, we'll see a little bit of a bump up because of that deferral. And then the following years, a significant decline. So you can see in the side, the change from 18-19 to a few years out is almost 11% reduction in 1991 realignment, almost 7% reduction in 2011 realignment, and almost a 20% reduction in Mental Health Services Act funding. Remember, Mental Health Services Act funding is solely a 1% tax on people who have net incomes over $1 million. And a lot of people have been impacted by the stock market decline. And so we think, and you know, different employment and economic impacts of COVID. So we think that we'll have those reductions, and we're going to have to figure out how we're going to deal with that. So let me just say that while we don't know exactly what that will mean to Fresno County's plans nor our department's plans, what I can tell you is we are going to have to carefully review all of the services we provide, all of the programs, all of our contracts, everything, and make some decisions about how we can preserve it. There's part of our budget are things like unfilled positions and such, and so we'll be looking at that. And as we make those decisions and come to some plans, then I will most definitely share that with you. Right now, I can't tell you exactly what that will look like, other than that we should be prepared that there will be some changes. And exactly what that looks like, I don't know yet, but I do know that we should expect those changes, and I want you to be aware of that. All right, so reopening criteria. Last week I went over in detail what the state is looking for from counties to reopen. Some of that has changed since last week. The governor, in looking at data, made a decision that some of the requirements might be too restrictive. So now they're looking at less than 25 new cases per 100,000 residents over the past 14 days. So for us, that means we couldn't have more than 250 cases over 14 days. We're not there yet, and we don't know if we will get there because we've significantly expanded testing. Or we have to have less than an 8% positive rate among people testing. So that's probably where we'll try and meet that one. We'll try and get more and more testing done and hope that our positive rate at any over 7-day period is no more than 8%. And then no higher than 5% increase in hospitalizations over a 7-day period, or fewer than 20 hospitalizations on any single day over a 14-day period. So what that means is at any given time there can be no more than 20 people in the hospital or you have to be on either a flat or a decline in hospitalizations over time. We're not quite there yet either, but we do have capacity in our system for hospitalization, and that includes ICU bed capacity and ventilator capacity. So last night, Fresno County submitted its second letter to the state. There was a first letter that went out last week, and some back and forth has happened with the state, and so a lot of work was done by our Director of Public Health, Dave Palmaville, and our Interim Health Officer, Dr. Vora, to address the concerns that the state had. And so part of that is the testing capacity increases as well as that capacity in the hospital system. So that letter went in last night, that request to the state to accelerate our reopening. And so one of the things about that is that I think that's probably why Dr. Vora issued that masking criteria. This is a negotiation with the state, right? And so if Fresno County is going to ask to reopen sooner and ask to be able to loosen some of those business closure restrictions, we have to also demonstrate that we're doing the right things in terms of mitigating spread or mitigating the pace of spread. And masking is one of those things that we can show the state that we're trying to keep that spread from overwhelming our healthcare system. As I stated last week, we're going to have COVID. It's going to be with us for some time. We should expect to see new cases. We should expect to see more hospitalizations. We should expect to see people die of COVID. But we're still trying, now that we've got some of our planning under our belt, having adequate personal protective equipment, having an adequate number of ventilators, having hospitals with a plan for how they would expand capacity into different parts of the hospital if they needed to. All of those things help to prepare us to get to the place where we can reopen and live with COVID. And so that masking, as annoying as it might be to some people, is simply that balance, the check and balance. We want to reopen, but we got to have some measures in place so that we don't overwhelm the healthcare system. And so that's the kind of thing I'm willing to do. I don't love wearing my mask, but it's one of those things that it's a trade-off. It's a trade-off to be able to wear my mask and still be able to go out and go shopping and that type of thing. All right. This is my usual slide. Stay home if you're sick, wash your hands, maintain your physical distance. Now it's time for questions and answers. Your thing?
There was only a couple.
Okay. Brian's going to tell me the questions, so I'm going to turn over my shoulder to have him ask them.
1 second. Actually, I think it's just all connected to one. I'm noticing that many are unfortunately relaxing their standards for distancing and having get-togethers with large groups, going shopping for non-essential items, and spending long periods of time in stores. Can leadership please emphasize the need to continue to limit your exposure, if not at least for the health of coworkers? I can stay home, but my efforts are nixed by others not doing so.
Okay, so this question, it's quite long. I'm going to try and summarize it. And for those of you who are viewing on YouTube, you can look at the question via chat. It's basically saying, gosh, I'm seeing people kind of loosen those restrictions, go out shopping in big groups, get together in big groups. And I'm worried that if we aren't following those restrictions, then we're going to increase COVID and maybe risk reclosing and that type of thing. And so the question partly was to say, will leadership keep emphasizing? Absolutely. We will keep emphasizing the importance of restrictions. And when we get to the point where people are coming back to work, you'll see that. If you're not already coming to the office to work, we already have some signs that remind people about the 6-foot distancing in our conference rooms in different locations. You don't see chairs bunched together. The conference room in my area, simply the chairs are gone. There's not chair, it's a large table and the chairs are spaced out so that you can't be that close to one another. We have signs up in the bathroom saying wash your hands when you enter, wash your hands when you leave. Really the thing that they're beginning to understand better, and again, this is one of those things that we knew a bit about viruses, quite a bit, and we're learning more about this virus. And so as time passes, the recommendations shift and change. And sometimes that gets confusing and feels like we don't know what we're doing. But we're learning, and that's why they change. And so one of the things we're beginning to learn is that there's beginning to be less concern about me getting COVID by touching something that you touched, or being around surfaces that someone might have touched that had COVID. And there's more concern about prolonged, close interaction between people. So within 6 feet for more than 15 minutes. That's one of the things when they do contact tracing that they ask that question. I think I've mentioned that before. And so the types of things that are going to remain a concern, that's why gyms aren't open yet. That's why nail salons aren't in this stage. Because those are circumstances where you're within 6 feet of one another for more than 15 minutes, just by nature of the activity. And so things like shopping, maybe that hasn't spread the virus because people aren't standing right next to each other for a long period of time. But we have went to telehealth because our former model of care was that someone came and sat in an office with a clinician or a case manager for over 15 minutes. So that's something we're going to have to look at as we move forward. And so you're going to see those changes in our department. And we will most definitely encourage all of you outside of work to continue to follow those guidelines. I think it's really easy to become complacent right now because we haven't been hit as hard as a place like New York City. And it's easy to tell yourself, well, we don't have public transportation here, and the density of housing isn't as great here. But you know where else they've had outbreaks? In churches and in places where people did choose to get together, sit next to one another, and particularly things like singing or talking loudly, where there's a propelling of aerosols and spit, frankly. And so those are the things that we're going to have to be really careful about for a long time. They are making some progress on vaccine, but we're at least many months away from a reliable vaccine. And we're learning more about the disease and treatment. But we're also learning things like kids are having a post-COVID inflammatory or immune response that's very, very concerning. And so as we learn more, we're just going to have to adapt our behavior to that learning. And that's hard, right? We feel like we're told something, I've been following the rules, and now they change. Well, they're going to change, and we need to adapt to that change and be flexible. Next question.
If someone is home due to being sick, what is the current guideline in order for them to return to work?
This question is, if someone is home due to being sick, what is the current guideline? I don't want to misstate precisely what it is, but on the website for the Human Resource Department, you can find that information. If you have COVID-like symptoms, we want you to be symptom-free, I believe, for 10 days now. But that's on that website, and you should be able to find that. If you're ever in any doubt, please contact our human resources. If you're not able to find the information you need on the website, you can call our human resource number, and they'll be able to walk you through and assist you with what your personal situation would require.
When will employees be able to travel for work outside of Fresno County?
This question is, when will employees be able to travel outside of work from Fresno County? I'm not exactly certain. This question was raised a couple of weeks ago, and we did look into it. I think the CAO had indicated that we really should not be traveling outside of Fresno County for any reason. And so really at this point, we don't have really good guidance on that, but as a practice with our department, we're not sending people to conferences. Frankly, the conferences aren't happening, so we're not doing that. We do have situations where some of our clients are outside the county, and we're really taking that on a case-by-case basis.
Okay. Will these COVID-19 changes affect our needs to the new building we are planning to acquire?
This question is, will the COVID-19 changes impact us getting the new building that we were planning to acquire? That's a great question, and one that we're really looking at closely. At this point, I can't tell you for certain what the impact might be. I can tell you that for sure, we're going to be looking at how we deliver care, and we're going to be looking at how our workplaces are configured. So if we do acquire that building, I'm guessing that how it's designed will change because of COVID. At this point, we definitely need new space, so we're going to have to figure that out. And as we really understand completely how we're going to use telework and telehealth into the future, that might adjust the amount of space we need. I don't know that yet. And so that's something that we'll be looking at very, very carefully as we move forward.
Are you planning on having us work from home for the month of June?
Are you planning on having us work from home for the month of June? Here's what I would tell you generally. Generally speaking, I hope next week to be able to give you a schedule of who might return to work and in what sequence. So if you're currently providing telehealth services and telehealth or telephone services to our clients, and generally it's going well, that probably will continue. That's something that we're looking at. If you work in an area in the building in an administrative or clinical fashion where you have a private office, it's a higher chance that you would come back to work sooner rather than later. And then we're having to make some accommodations throughout our offices to make sure that we can A, keep the 6-foot distance, B, that we have some reassurance working with public health and such that the configuration, particularly in like cubicle areas and such, that if we have separations, is that sufficient? And so those are the things we're working through. I wish I had a definitive answer for each and every one of you, but that will come over the next week or two. All right. I don't have any more questions today, but again, as usual, please contact us if you have questions. I'll continue these video presentations weekly. I think it's been a good opportunity for me to interact with all of you and answer your questions, and so that will continue. And thank you, and have a good week. Tomorrow's mismatch day.